Welcome back, everyone. Before the break, we were looking at some of the signs and symptoms that parents, friends, families can watch for in kids, teens, adults in terms of planning for suicides, homicides. And Dr. Clark, you were talking about, some of the behaviors that's associated with being depressed, anxious in terms of, sleeping patterns, being out of whack, aggressive behaviors, increasing eating patterns, being out of whack. Now, in terms of, say, someone is at in that situation and it's now progressed beyond the point where, they feel like, that's it. I'm just, I've used all the drugs, it's not helping. I've drank all the alcohol I can, still, it's not helping. They're going to take their lives or take someone else's. As a result, do people always, because from my experience, because I have worked with people who have attempted suicides, and often for the families that are friends in that situation, a lot of times it's such a shock and such a surprise to them that this happened. And however, when you sit and talk to people and analyze things and look through, you see that there were many signs along the way, but people just didn't know what they meant. Can we talk a little bit about what that, because not all the time people leave a suicide note, not all the time are they. Sometimes they'll come and say, I'm going to kill myself, or I want to kill myself, or I want to die, or going to kill somebody. But lots of times they don't.
Right.
So how is somebody to know,
Well, I think, if you see, fundamentally, you said it before, we have to be talking to our children, and even more importantly, listening to them. And if you see, like at an elementary school, the amount of parental involvement, they tend to be most involved in their children's life the younger they are. And then as they get to this age, probably where they need the most support and parenting, parents tend to become much more relaxed. It's hard to get them out to a parent-teacher meeting. And so very often they just don't know what's going on inside that, either because they get busy or they seem fine. Look, they can take the bus, they look okay. But it's important to have those conversations and to say and listen. This is one of the biggest complaints among high school students is, well, why don't you talk to your parents? Well, my parents don't listen to me because I tell them I have a problem in school and they start trying to solve the problem for me. They said, I'm being bullied. Well, you just need to have a fight with that boy. And so they don't want advice. What they want is somebody to listen to what they have to say.
Can you say that again? Because it's simple, but fundamentally important, because there's such a difference. And having raised 2 kids myself, I know I'm also, even though I know better, I know I've been guilty of that many times. But my kids had the self-confidence to tell me that, I don't want you solving my problem. I just need to talk. Say that again, because it's so important to understand the difference between listening and hearing, really hearing what the person is saying, as opposed to trying to solve their problem, trying to give advice.
Well, the temptation is always, my child, is telling me they have a problem, and so I want to be involved. I'm going to tell them the answer to this problem as I would solve it, and they don't want that. You're not me. You don't know the situation. Can you please just hear me tell you this? And so what can a parent do? You listen. You can ask questions, encourage. So as they say, this kid's bullying me, and so what do you think you'll do about that? What are your options? Well, I could do this, or I don't have any options. Oh, well, I don't know if you don't have any options, right? Like you can guide them, you can help them, but the more that you're able to listen effectively, the better chance that you have that they're going to come back and talk to you the next time. Because if you tell them, you just got to beat that kid up. You got to go in and tell them something that they're like, I'm never going to talk to my parents again, because they're always trying to. This is just another way. They're trying to boss me around. And so yeah, as much as possible, listen. And I mean, I wish that, yeah, we could give this message to parents and have them listen. I suppose it's really a symptom of part of the reason we do see all the time when there's a suicide. Well, we just didn't know. But I don't know if they're being honest. If they knew much of anything about what their child was experiencing.
In terms, I'm sure there are a few who just weren't paying attention. I'm sure that happens. But I think in most cases, parents, I think they think they're paying attention, and I think they're doing what they know to do. As you say, trying to solve the problem, trying to get, rather than really listening, going with the kid in terms of where their head is at, trying to understand how they think about things, how they problem solve. And that's where often the mistakes happen. So I think for them, when they're saying, we just didn't see that, I really think they didn't understand. They're seeing, because one of the things from my experience with, for example, and I'm sure you're aware of this, sometimes when people get to the point where they decide, okay, that's it, I'm going to do myself in, and they have their plan and they have it all worked out, nobody knows. And that's usually at a time when they seem most peaceful. They present most, I guess, relaxed, or from an outsider looking on. That's how it seems, that they seem peaceful, relaxed, they seem happy, they're going and visiting all their friends, when really they're visiting them to say goodbye, but nobody knows this. So for someone who hasn't had that experience, and they see that, if this child was in this dark, foul, depressed mood, and suddenly, for the past day or two, they seem happy, they're going and talking to their friends, they're sharing their belongings with people. They don't see that these are signs that they're saying,
Well, if it gets to that point, again, if it's a very complicated situation where they would appear to improve, but actually, they're now happy because they're resigned to the fact that they're going to commit suicide. I think you have to be on it before then. If they get to that stage, wow, so I think, again...
So what does somebody do if you're seeing...
If you're seeing the withdrawal, the depression?
And that switch.
Well, do something, right?
Is that a time to go see a doctor, psychologist?
You're overdue. Go to the, if you see that kind of behavior, emergency room. Like you cannot downplay the importance. I doubt that there is, if you want to overreact, you can, and that isn't that some kids, when they're mad, say, well, I'm just going to kill myself. You get an ear for it, but often the ones that are actually going to harm themselves or kill themselves don't threaten it in a fight. That's true, they don't. So it's...
Just to caution everybody, not to say that you shouldn't listen and respect and take it seriously if someone says, I'm going to kill myself. But you're right, in most cases, every experience I've had with people who've attempted, I've never had anybody that actually died, but attempted suicide, they didn't tell anybody. They had their plan and they kept it quite secret until they acted out. So yeah.
It's not to say that
you win your case.
It does come up, if you see them lethargic and, they say, but they would say things probably in discussion like, I'm so... I just don't see the purpose of this. I can't go on like this much longer. Those types of hopeless talk. Again, sometimes they won't amount to any kind of self-harm or suicide, but they should be really alarm bells to parents or caregivers or friends that let's not wait to find out, right? Like let's call somebody, and if I'm wrong, if I've overreacted, well, so be it, and then we'll get to the bottom of that, but that we don't.
Exactly. So important, so important. I know it's difficult for people to recognize and accept that they need help and counseling, and like you said earlier, and so true, particularly when it comes to psychological and mental, emotional needs. We as a society are so afraid to embrace treatment, medication, support for that. But like any other illness, it also...
And there's a huge, depending on your background, depending on your culture, you know, we live in a very multicultural society. Some of the societies we have in Peel, in Mississauga, in Brampton, no, we don't have depression. Or certainly if we have depression, we don't tell anybody about it. And so now those families are maybe more at risk than others because we'll just keep that at home. That's private. We're not going to tell anybody.
So true.
And so that's an added risk.
Huge risk. Huge. I'm so glad you brought up huge risk. In the case of unfortunate someone, as in the case like Amanda Todd and others, it gets to that point. What is the after effect like for families, for community? How does a family cope with a child committing suicide or homicide? How do you begin to cope?
Oh, it's devastating. It's one of the hardest things for people to recover from because there's a death. Okay, so there's a grieving process, but it's complicated. It's enormously complicated. The family goes through, you know, not only the loss, but the guilt, the regret. Is there something I should have been able to do? It's not uncommon for families who have a child who's committed suicide not to tell anyone, actually to say they died in an accident or they died from other causes.
Wow.
Yeah, even, you know, admitted to the same hospital where they were treated for their mental illness. You know, a daughter will go, you know, the other child will go in and they'll ask about the son who committed suicide and they'll say, no, he died in an accident. They won't tell them because, again, the tremendous amount of shame and denial. This didn't happen.
And on that note, because we're just about at the end of our show, thank you very much for watching and being a part of our show. And we will see you next week. Take care. Goodbye.